My name is Dr. Joseph Baluku. I am an internal medicine physician with Chirudu National Referral Hospital. I currently head the cardiopulmonary division of the hospital. So in 2017, I had the opportunity to enroll into a postgraduate diploma, which was fully sponsored by Merck Foundation, and this was an online diploma with the University of South Wales. Thereafter, I also had the opportunity in the year 2000 to pursue a Master's of Science in Preventive Cardiovascular Medicine, which was also fully sponsored by Merck Foundation. I was seconded by the Ministry of Health to pursue this Master's. And this is important to us because in most of our countries, we see a convergence of infectious diseases and cardiovascular disease. And therefore, this master's training was very key in equipping me with knowledge and skills of managing cardiovascular disease, especially among people who have had a history or have concurrent infections, which is something we are beginning to see quite a lot in Uganda. The course content was very scintillating, partly because it covered most aspects of the challenges we face, from lipid disorders to obesity to high blood pressure and how to manage it. And as well, what I thought was very important to me is cardiovascular risk scoring. In fact, for my Masters of Science, for part of the research requirement, I focused on a systematic review and meta-analysis of all studies in Africa that have looked at cardiovascular risk factors among people with tuberculosis. And I found a very high prevalence of cardiovascular risk factors among people with tuberculosis. Course content, therefore, is important because it points out the important issues that Africa is grappling with that need to be addressed, especially in the context of infectious diseases such as HIV, such as Helicobacter pylori, such as tuberculosis. And this convergence of these two diseases is very important for us to study, as this course provided this opportunity for me to do so. From the training that I received, both from the postgraduate diploma and the Masters of Science, there are two major things that I've been able to undertake. Number one is that I have integrated cardiovascular risk scoring in my daily practice as I see patients across the spectrum from infectious diseases to non-communicable diseases. Secondly, I have a strong passion in research, and so I successfully applied for a research grant to study cardiovascular risk factors among people with tuberculosis. And we are currently conducting a study across 5 regional referral hospitals in Uganda, where we are looking for cardiovascular risk factors among people with tuberculosis. And the results we are getting are very interesting. And this was really because Merck gave me the skills, the insight to look into this problem that we are having across Africa. And those are the two most important things that I feel that this course has helped me to achieve. Of course, I also conduct CMEs for my colleagues in my department, and the CMEs are really geared to pointing out the problems that infectious diseases are posing in regards to the increased burden of cardiovascular disease in Uganda and in Africa. Recently, I was a key speaker at the Day of Lung Science for the Makerere Lung Institute, where I focused strongly on highlighting the mortality that is related to cardiovascular disease among people who have survived tuberculosis, and the need for us to follow them up so that we can risk score them and have interventions that prevent cardiovascular disease amongst these individuals.